Hello, I am Alicia Mathis, and I am going to talk today about cerebrovascular accident, also known as CVA, and stroke. A stroke is an event in which blood flow to brain tissue is halted either by obstruction or hemorrhage. In the United States, every year 795,000 people have a stroke. About 610,000 of these are first-time strokes, and 185,000 are people who have had strokes in the past. 140,000 of these people die every year. 87% of all strokes are ischemic. And so cerebral vascular accidents are the leading cause of long-term disability in the United States. And according to the CDC, the cost of a stroke in the United States alone is approximately $34 billion each year. The most common cause of a stroke is the occlusion of an artery by an atheroma, which is a plaque that is built up within the lining of the vessel. These generally develop in large arteries such as the carotid artery. This results in gradual occlusion of the vessel, which can eventually become completely shut off, which then results in infarction. Vessels can become acutely occluded by an embolus originating in another part of the body. And once it breaks off and moves through circulation, it can lodge into one of the small cerebral vessels. This will then cut off any blood flow to the tissue surrounding. The emboli can be composed not only of plaque from an atheroma throughout the body, but it can be stemming from something such as air, vegetation from endocarditis, or even pieces of tumors. Hemorrhage is a cause that is severe and can impact large areas of brain tissue. This occurs when one of the cerebral arteries ruptures due to increased pressures in the vessel, and this is generally caused by hypertension. The displaced blood then causes an increase in intracranial pressure. Therefore, the effects can be seen in both hemispheres of the brain. The manifestations depend on the location and functional area which is affected. Flaccid paralysis is generally the first thing that is noticed. Hemorrhage generally manifests a sudden headache, a sudden severe headache that is, and severe neurological deficits. A large portion of the brain is supplied by the middle cerebral artery, and lack of blood flow from this manifests the symptoms most commonly associated with stroke, which include the contralateral weakness or paralysis and aphasia. Visual disturbances will occur if the occipital lobe is affected. Occlusion or hemorrhage in large arteries can result in immediate coma or death. Long-term effects depend on the severity of the occlusion or hemorrhage and how quickly medical intervention is obtained. Prognosis is severely reduced every minute that goes by without intervention, as the longer the brain goes without oxygen, the more tissue is damaged. Now, this is a poster that is distributed by the American Heart Association, and any health facility, hospitals, doctors' offices tend to have posters like this hanging. So this is a really good educational tool for the common public. So this acronym FAST is really beneficial. It is short, sweet, and to the point, and it explains thoroughly what you need to look for a stroke and then what to do. So we have F, which is facial drooping. Is one side of their face drooping down, or is it numb? And it tells to, ask the person to smile. Is their smile uneven? The next is A for arm weakness. The same with their smile. Is one arm weak or numb? You can have the person raise both of their arms to see if they're unable to move one of them or if it drifts downward. S is for speech difficulty. If it's slurred, you can have them repeat a sentence after you. This poster gives an example, the sky is blue. Are they able to repeat it correctly? And then T is time to call 911. So they need to go to the hospital immediately if these symptoms are present. So using this as a quick and easy tool for the public is really beneficial. So when they get to the hospital, you're going to have an option of a lot of different diagnostics. For example, CT scan is usually one of the first things that happens. This is a rapid way to determine whether the CVA is a result of ischemia or hemorrhage, as certain treatments cannot occur with a hemorrhagic stroke. An MRI is not as quick, but can give an in-depth look at the exact size and location of the stroke. Angiography can be done at the same time as a non-contrast CT and will give the provider insight to deficiencies in vascular perfusion. You have diagnostics such as electrocardiogram, chest x-ray, echocardiogram, and cardiac markers. And this will also provide insight to what's going on if it stems from a cardiac event, because then they will also need to treat the cardiac event as well. Then you also have coagulation studies such as prothrombin time and activated partial thromboplastin time, and these show how well the body is coagulating to prevent bleeding, which if they're bleeding, that can increase the severity of the stroke. So you have different medical management depending on what type of stroke it is. For ischemic stroke, you want to know the last known well. This is important to analyze further treatment options in order to preserve as much function and prevent further damage. Time is of the essence. Some treatments can't be given, for example, after 4 hours, and depending on the manufacturer of TPA or your facility's policies, 4 hours might be the cutoff. Oxygenation is always important, especially in times with possible ischemia. Elevated blood pressure is a normal biological response to counteract poor perfusion. So with TPA therapy, the blood pressure is to be maintained at or below 180 over 105. And if it goes over this, you want to make sure you administer antihypertensives such as labetalol to bring that down. Fluid balance is also important to maintain adequate perfusion. TPA is a fibrinolytic therapy used to break down clots. Now this is a very, very strong drug that requires very close monitoring while a patient is receiving it, and also for 24 hours after treatment. Providers must not only review a CT in order to rule out hemorrhage, but do a medical history, a thorough one, to rule out any possible bleeding throughout the rest of the body. Any indications of bleeding disorders will disqualify a patient for this treatment, as severe hemorrhaging can occur if TPA is administered. Aspirin therapy should begin within 24 to 48 hours after to help prevent further ischemia and future strokes. Just like with the occlusion of heart vessels, stents can be placed inside the arteries of the brain to open up the occluded vessels. So this is where you would see the endovascular therapy. With hemorrhagic strokes, BP is going to be more likely going to be maintained at a normal or higher range, under 160 to systolic, to ensure adequate tissue perfusion. If the hematoma from the bleed is covering large parts of the brain tissue, this can cause a marked increase in intracranial pressure, or ICP, which can have a detrimental effect on neurological function. Therefore, surgical reduction interventions will need to occur to remove this excess blood and reduce the pressure in the brain. Ruptured aneurysms can be clipped to stop the hemorrhage, and surgeons can also coil or clip other non-ruptured aneurysms in order to help prevent future ruptures. As far as nursing management, immediately you want to assess the respiratory status and the cardiac status to ensure that they're stable for the most part. You want to make sure that they're go through your ABCs, airway, breathing, circulation. And then you want to assess their neurological status. Make sure that you get a baseline for what's happening. You will also want to find out their medication that they're taking. Are they taking antihypertensives? Are they taking illegal drugs that can interfere with any of the therapies that might be occurring? Or are they already taking anticoagulants? You want to do as well a medical history, make sure that they don't have any risks for bleeding, or do they have previous strokes that they are already taking medications for? Do they have a family history of stroke, and what is their family history to ensure that treatment is adequate? You'll also want to assess their functional health patterns, because they may already have a baseline that is stroke-like. They may already have, one side of their face is weak, one side of their arm is weak. They might have had that previously. So again, knowing their baseline. So nursing plan and implementation is really focused around education. And you want to educate those about reduction of risk factors to prevent future strokes. You will also want to teach patients who have long-term effects such as hemiparesis about how to perform activities of daily living. You can work with PT and OT to ensure that they have the tools they need. You might want to use a speech and language pathologist. You might want to bring them in to ensure that patients can swallow appropriately, or if they need modified diets. Nurses also help coordinate with outside facilities to ensure that patients receive the appropriate follow-up care and rehabilitation. This will ensure their success in re-entering their normal home life post-stroke. Also, making sure that family members have the tools they need will prevent any apprehension about the patient's diagnosis, treatment, and post-treatment care. Now we move on to the risk factors. So we have non-modifiable and modifiable risk factors. I did place some in both columns because, prevention of diabetes is a modifiable occurrence. The same with heart disease, hypertension, obstructive sleep apnea, hyperlipidemia, elevated cholesterol. But even if you live a healthy lifestyle, sometimes if you have genetic factors, you might develop diabetes, or you might develop heart disease. Even if you are on specific diets, you can develop hyperlipidemia or cholesterol if you have the genetic factors there. So you want to have a healthy lifestyle to prevent these disorders. And then when you do have these disorders, even if it's out of your control, that becomes non-modifiable, and you just need to manage those disorders appropriately. Prevention includes healthy diet, maintaining a normal body weight, and by doing those things, you generally will maintain a normal blood pressure, exercise, avoid or eliminate tobacco products, and then reduce or eliminate consumption of alcohol products. A couple cultural, economic variables that go along with stroke. So those with African descent have a higher incidence of stroke than Caucasians, and a higher incidence of first strokes. They also have a higher rate of obesity and smoking, and twice as likely to die from stroke than Caucasians. Those with Hispanic, Native American, and Asian descent also have a higher incidence of stroke than Caucasians. Native Americans generally have more risk factors, generally multiple risk factors at once than Caucasians, and Hispanics have a high rate of diabetes. Now, to speak on that, there are a lot of health disparities in the United States, and that has to do with, the different populations, such as Africans, Hispanic, Native Americans, don't have as good of access to health care. Here's my works cited. Thank you very much.